Hey, my name is Karen Rasponi. I'm in Kinesiology 220, the online section. I think it's VA84. But today I'm going to demonstrate how to put on and take off exam gloves, as well as a few safety precautions that you should take into consideration when wearing the gloves and working with others. So the first thing is that anytime you anticipate or are about to be exposed to bodily fluids of any kind, be it blood, vomit, anything else, you're going to want to wear exam gloves to make sure that diseases are not transmitted, to make sure that you are not catching any of those or passing them on to somebody else down the line. So my gloves that I got are actually not latex, as we discussed in the notes. Mine are vinyl because I know a lot of people that are allergic to latex, and I just didn't want to risk it. So I got the vinyl gloves, and I also got small ones that'll actually fit on my tiny hands. But basically, the part that's a little bit more difficult or more specific is taking off gloves rather than putting them on. So I'm going to go through the 4-step process that we talked about in our notes and in the textbook that will allow you to take off these gloves after, assuming you have been in contact with some type of bodily fluid, probably blood, if I had to guess, is the most common. But first thing that you're going to do is take off one of the gloves partway or halfway by pinching near your palm. So you're going to take off this glove about halfway-ish, and then going into step 2, you're going to completely remove the other glove that is completely on. So using my fingertips, I'm going to remove this. Now this goes kind of from step 2 into step 3. Step 3 being that you pull the second glove completely inside out, and I'm just going to kind of hold it in this hand. But for step 4, what you're going to do is grab from the inside of the glove still on your hand, and at this point you're going to pinch, see, and turn inside out. Basically you have a little baggie of both of your gloves now, but this is because this inside of the glove has only been touched by your hand. These are the parts that are not contaminated, so therefore these are the parts that you're going to want to touch when taking off your glove. You do not want to touch what would have been the outside of your glove, which would have touched the victim, touched the blood, or touched whatever other bodily fluid you might be able to get diseases from. But past this point, your gloves are now off. You are only touching parts that have touched your hand, parts that are completely clean. But you do still want to dispose of your gloves properly. So you definitely do not want to just litter. You definitely don't want to just throw them in the trash can, because these diseases may, this is going to sound crazy, but they may of course be transmitted even though you threw this in the trash. Somehow, you never know what's going to happen, but you still could let these diseases get out. So ideally what you want to do is put them in maybe a sealed bag and make sure later on you can dispose of them properly, and past that, you're pretty much good. You have put on your gloves when you were about to be exposed to the bodily fluids. You have taken them off using the 4-step process, and you have disposed of them properly. So at this point, the only thing you may want to do is, for extra precaution, to make sure that you do not get some of those diseases that can be communicated even through gloves, you might want to wash your hands. So wash your hands with soap and water. That process for washing hands is outlined actually in the books, or in the book and in the notes. But if you do not have soap and water, hand sanitizer would be your best bet, or your next best. But you do want to wash your hands afterward, just to completely ensure, just in case, that you're not catching any diseases from the people you're trying to help. And overall, with this process, you should feel safe that when you stop to help somebody or stop to respond to an emergency, you will be fine. You will not catch a disease from it, and you will walk away exactly as you walked up. So that's all for the glove demonstration video. And once again, my name is Karen Rasponi, and that is all. Thank you.